I'm sharing 3 frequently addressed concerns that I get when I work with my knee patients and tips that have helped them overcome that during my time. So the first is having pain when you're going up and down stairs or up and down hills in your knees. And my tip for that is thinking nose over toes. So the more that we lean our body forward and our nose gets over our toes, it helps with our center of mass and it takes pressure off of your knees as well as engages your glutes and your hips, which are the powerhouse to get you up the hill. So that's what you want to be focusing on with that. The second thing is having knee pain with stretches around your hip. I get a lot of complaints in yoga classes with knee pain when we're doing some of our end of the class stretches. So if you're in a position like this, and you're starting to feel pain in your knee, it likely is due to immobility in your hips. So our knee is a hinge joint. It goes in just a couple, but mostly one direction, forward and back, whereas our hip is a ball and socket joint and it has a lot of degrees of movement. So if we can get more mobility here in our hips, we will take more pressure off of our knee and not tweak it as much. And the last thing, I get a lot of complaints about knees being noisy. And as long as you are moving, we are likely making noise with our joints and bodies and tissues. And so it's completely normal unless it's giving you pain. And you definitely need to see a movement therapist or other practitioner to help with that. But if you're having noise, a very common reason is patellofemoral syndrome, which is just the way that the kneecap is tracking on the knee. So a way that you can assess it is either, you just heard mine pop actually, I press my kneecap in towards the midline, and if I try and straighten my leg, I don't hear that pop as much because I know that I have tightness here and I need to work on that. If that doesn't do anything, you might want to try moving the patella in this way and just play. If you can move it, it might be a tracking issue. Again, if you don't have any pain with it, you don't need to be concerned, but we can also do those types of mobilizations, assessments on not only your knee, but your legs, your hips, and your low back to see where the breakdown is coming from and try to look at you from a whole picture and get those discomforts to go away. So I hope that was helpful. And of course, let us know if you have any questions.